Hello, my name is Amy Tyberg, and I am an interventional endoscopist with Hackensack Meridian Health, working at Hackensack University Medical Center, JFK University Medical Center, and Jersey Shore University Medical Center, and serving as Associate Chief of Advanced and Therapeutic Endoscopy for the network. I am honored to have been given the opportunity to write the article entitled Lumen-apposing metal stents in 2024, Troubleshooting and Managing Common and Uncommon Adverse Events with my co-authors Thomas Kowalski and Kenneth Binmoller. This article is important because the emergence of lumen-apposing metal stents has revolutionized the field of advanced endoscopy and spearheaded the emergence of the subspecialty of therapeutic EUS, with LAMs being used not only for the improved indication of drainage of pancreatic fluid collections and walled-off necrosis, but also for a plethora of off-label, minimally invasive procedures, including EUS-guided transgastric intervention, or EGI, EUS-guided gallbladder drainage, EUS-guided extrahepatic biliary drainage, including choledochoduodenostomy, and endoscopic gastroenterostomy. And these procedures have been repeatedly shown in the literature to be associated with high efficacy and safety rates. However, adverse events can and do occur even under the most experienced of operators, and it's critical for anyone embarking in therapeutic EUS to be able to recognize, understand, and treat these adverse events. In this article, we discuss some of the most common adverse events that occur, and most importantly, some guidance on how to manage them, and some tips and tricks from our collective experience to prevent them from occurring in the first place. The most common adverse events that we discuss include bleeding, which can occur from vessels within the bowel wall, vessels between the bowel wall and the procedural target, and vessels in the target wall or within the target. Maldeployment, aka deployment of either flange of the LAMs in an unintended location outside of the target lesion and or the GI lumen, which results in a leakage of luminal contents synonymous with the perforation. Migration, which differs from maldeployment in that it is movement of the LAMs out of the intended fistula tract after initial satisfactory deployment, and this can happen either acutely, meaning prior to a mature fistula formation, which we believe from animal studies takes about 10 to 14 days to occur, or chronically, meaning after formation of a mature fistula. Embedded or buried stents, meaning there's overgrowth of gastrointestinal mucosa into the flanges or interstices of the stent, mainly occurring when the distance between the GI mucosal and the procedural target approaches the saddle length of the stent, which for most of the LAMs is 1 centimeter, but there is a stent that comes at 1.5 centimeters. When the stent is placed in an area of inflamed neoplastic or post-surgical tissue, and or when the stent dwell times are prolonged. And lastly, delayed LAMS occlusion, when the lumen of the LAMS becomes obstructed over time. And this occlusion generally results in recurrence of the symptoms that led to the indication for the initial procedure. And we discuss each of these adverse events, both in regards to all therapeutic EUS procedures in general terms, but also more specifically in regards to each of the individual therapeutic EUS procedures. We provide several tables of how common each of these adverse events is in the literature, and some examples of different management techniques that can be performed when they do occur. In many cases, staying calm and being prepared can allow for successful endoscopic salvage of the procedure. And in addition, at the end of each adverse event section, we pooled our collective experience to provide tips and tricks in how to prevent each of these adverse events from occurring in the first place. So in conclusion, therapeutic procedures using LAMs continue to become increasingly widespread, and although LAMs are designed to be operator-friendly in deployment, adverse events from LAMs placements can and do occur even in expert hands. With increasing number of procedures being performed, it's expected that there will be an increase in adverse events from LAMS placements, and my co-authors and I are excited for the opportunity to present a literature review as well as our collective experience on how to recognize, manage, and avoid these adverse events in order for therapeutic endoscopists to be able to provide optimal care to their patients when engaging in therapeutic EUS procedures.